It's time for another ProNex Inc. Podcast, and I'm here to share that with you. My name is Karol Clark, and I am the host of the show. And I'm excited to bring on someone who has recently made a transition we'll talk about and who has chosen ProNex Inc.'s lifestyle medicine, the CORE LMP software platform. So let's dive into why that is and some of the details about why this is such a great option for anyone who's practicing lifestyle medicine.
Good morning.
Good morning. I am so excited to have you on the podcast today. And you're talking about a really interesting topic that I have actually seen a few times, of course. You've been a well established, or you are a well established bariatric surgeon who recently made a switch after how many years?
24 years. Yes.
24 years. Yeah, so big change. So Dr. Chu is based in Louisiana. I'll let her tell you a little bit about her story, but she has actually recently transitioned from general surgery, bariatric surgery, into lifestyle medicine and longevity health. So tell us a little bit about how you made that jump and a little bit about your background.
Yes. Thank you, Carol, for having me here today. Yes, I started in bariatric surgery about 24 years ago. Um, Surgery, I love surgery and I love being able to help people lose that 100, 200, even 300 pounds and watch them, regain their life back. It's been an amazing journey. But, one of the common factors, or toward the end, the last, I guess, 10 years of my practice, I really focus on the lifestyle changes to either help prepare them for surgery or to help them maintain their weight. Um, the surgery was always the simplest part of their journey because I know they'll lose the weight. And most of my post-op visits were longer toward further out they were from their surgery because we focus a lot on lifestyle. And so at some point, I found that I was able to successfully help patients lose a significant amount of weight, even without surgery. Some of them I just needed to give them the confidence and the knowledge, but they just needed to know that they could do it. And then as long as I was able to, if we worked together, they're able to lose some of that weight. So, my interest just became more complicated in terms of weight management. So I guess I've always been curious and always wanting to learn. And so when surgery became a little bit more routine, I became more interested in the true science of weight loss and, studying a lot on the biochemistry and the brain health and all that. So that's what's really intrigued me about the weight management. It's really, really complex. One of the things I've learned to appreciate is how amazing God is in designing our body. There's so many backup mechanisms to help us maintain our weight. So that's where the challenge is in understanding where that balance is, is broken.
Right.
Um,
Talk a little bit about, a lot of bariatric surgeons certainly are interested in having long-term successful outcomes with their patients. But oftentimes as a surgeon, you don't really have the time to delve into the lifestyle side of it, the whole nutrition side of it. And so oftentimes because of your schedule, you end up outsourcing that, so to speak, to psychologists, dietitians, nutrition, that sort of thing. I'm intrigued by the fact that number one, I know you live this lifestyle yourself, but how you were able to integrate that and grow that interest and your ability to help your patients in that way, in addition to the remarkable benefits of weight loss surgery for patients.
yeah, that's a challenging part. Uh, when I spend too much time with the patient, my nurse has to come knock on the door and say, "You got to, you have more patients to see." So that was challenging. So that's where I had to make the decision of where I wanted to focus my energy. There's some great bariatric surgeon. My partner is amazing, Dr. Email. There are lots of surgeons out there that can handle or that likes that aspect of patient care. I just felt that I was called to do a little bit more than just the surgical part. So that's where I had to make the decision to shift away from the intense, lifestyle of a surgeon to spend a little bit more time with patients in the office and coming up with a program, utilizing whatever technology that we have these days. We have great, amazing technology these days that could help patients through their journey to the healthy lifestyle.
Yeah. Talk a little bit about your new practice. I've gotten to know you fairly well over the last few months, but I love your vision for your practice and the fact that you're integrating, obesity management, lifestyle medicine, and longevity health all into one right there, and that you're actually continuing to help some of your existing patients. So can you talk a little bit about your vision for your practice and a little bit about the details for the name
Yeah.
and where you are and how you're evolving that practice?
Well, I came from a hospital-based multi-specialty group. I had a clinic director, I had an office manager, I had a head nurse, a medical assistant, a full team of delivering this care. And so, when I left that practice and went into solo practice, it was a little challenging, but like I said, I can harness a lot of technology to help me guide me through this new clinical practice. So I wanted in my vision, I wanted a community-based practice. It's really hard, as an athlete, it's really hard to do things on your own without a community to support you. We have a running group that starts at 4 a.m. And if I didn't have to get out of bed to meet my running partner, I would probably not have. But because we're consistent and we're there for each other, we pull each other and help each other through that process. So the same with community. I found that the patients who came back to see me on a routine basis was able to stay on track. Even with surgery, if you're not seeing your surgeon on a routine basis, it's really easy to get off track. So I definitely wanted more of a community, bringing in physical therapy groups, stress management, lifestyle modifications. So if a patient came to me with heartburn, let's say, traditionally you would just give them heartburn medicine, but in my practice, I wanted to look and see what's going on in their life, what's stressing them enough to release all this acid, how's their sleeping habits, and then educating them on their sleep routine, their stress management, and hopefully providing some sort of community support to help them educate them on those lifestyle changes. But there's so much that we are capable of doing for ourselves if we can just harness in on our inner strengths. And society has taught us to look at beyond us to find solutions, a pill here, a magic cream there. So I really want to bring people back to their natural health and to rely on their inner strength to help cure some of these deficiencies or illnesses.
Yeah, which ties right into the name of your new practice. What's the name of
Yes.
your new practice?
Well, we went through a lot of renditions, but I felt that our current name, Chu Precision Health, truly describes how we can individualize it instead of generalizing it, and trying to really, get to know the patients and deliver a more precise medication or more precise treatment for them. that's tailored to them. So it does, and there's a lot of, with our technology, I'll be able to stay in contact with them at various touch points, either through texting or email or, a phone call or something. But texting and email, and like I said, our software is able to deliver them educational materials every week just to remind them what needs to be done. Sometimes when you leave a doctor's office, you're just overwhelmed with everything that they tell you to do. So our technology is allowing us to just kind of deliver it slowly once a week. They'll get a little reminder, a little nudge about some habits that they need to work on.
And you've embraced lifestyle medicine. Can you talk just a little bit about what lifestyle medicine really is, and how you integrate that into your practice?
Yes. So, one of the pillars of lifestyle that is overlooked a lot in general healthcare is stress management and exercise. It releases the most amazing hormones in our body, the endorphins, the dopamine, that really helps keep us in balance. And in today's world, and I've been through this, where we're just getting up and jumping out of bed and go, 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 looking at your calendar, following your calendar, and then you come home and you're exhausted, and then you eat something sweet because you're like, you know, just out.
Mm-hmm.
So, just simply taking a few minutes in your day to take 3 deep breaths is really good and release endorphins instead of, taking some drugs to kind of calm down your nerves and deal. So, there is just so many techniques that we can use, or just getting some sunshine is amazing for our mental health. And, staying indoors and in our offices all day long. And, as a surgeon, I went to work in the dark and I left in the dark. So it was really hard to get daylight in. So yes, so just some simple basic, like I said, going back to the basics, walking around the grass barefooted to ground with the earth. I know
Mm-hmm.
it seems strange, but after I do my run, I always take off my shoes and socks and just run on the grass for a little bit.
Right, right. And so many of us read about all these treatment modalities, but we don't actually put them into practice. So it's motivating, just hearing you talk about it. I'm sure it's like that for your patients as well, to get them to try things that are the simplest things, but can make a huge difference in their life. So strategies like that you're mentioning, obviously would be very, very helpful.
Yes, it's amazing how much we can do.
Yeah, yeah. So the transitions occurred, and imagine it's a lot different.
Yes, yes, but it's great. It's just my focus is different, just trying to figure out how to understand patients. The psychology of, mental health is really important. As I watch my patients go through their different phases, it all depended on their mental health, how stable that was for them in order for them to succeed. Sometimes life is very, very overwhelming. And so there's just no way that they could reasonably, focus on their own self-care when the environment or their family is placing a lot of stress on their life. But so yeah, so focus is trying to figure out understanding patients, understanding behavior, and trying to get a good program for them so that they can
Mhm.
succeed with some of these challenging lifestyle changes.
Yeah.
Exercise is just very potent medicine. I always tell them that think of exercise as a pill. You just got to take your pill every day. So you just
Like
got
we
to
have to
take
do.
your 10 minutes of walking or 10 minutes of deep breathing. It's just got to be part of your medicine to make you feel better. But
Yeah, just like
most
laundry, just like everything. You just got to do it, huh?
Yeah, but
Um,
people view exercise as a tool to lose weight. It's a torture thing. But if you just look at it differently as a medication and a way to improve your brain health and not don't care, you know, and not focus on the weight loss component because, you know, that can be is associated with a whole bunch of negative thoughts in our brain.
Yeah, yeah.
So, yeah.
And then
So
you
just,
also bring up, I know you're a big proponent just for longevity health. So can you talk a little bit about how you entwine that in your practice and truly about,
yeah,
we're all interested in how to improve our longevity and to be healthier as we age. What
right.
does that look like
So,
for you in your practice?
you know, the technology or medications helped us all live longer, but the quality of our life, you know, we have to start thinking about that now. You know, Alzheimer's and Parkinson's is just it's, you know, it's becoming an epidemic because we're living a lot longer. But also, these disease is environmentally influenced. So as we live longer, if we want to be more vibrant and have a lot of vitality, you know, that's the most important thing is how healthy are we as we age. And, you know, our mental health, our memory starts to deteriorate at the age of 40, almost, you know, 15, 20 years before we really get old.
Oh,
And, you know, it's, you know, we just kind of brush it off. Oh, I just forgot that. You know, I can't remember faces. You know, I lost my keys. And so little clues like that indicates that our brain health is deteriorating. So I really think the big focus for longevity is going to be number one, your fitness, your mobility, your muscle. And then number two is going to be our brain health. And that's influenced by what we eat, what we breathe, you know, and where we live, kind of deal. Which, you know, today's world is so difficult to avoid all the toxins that, you know, we're exposed
mhm,
to. So yeah, so I really think brain health is going to be one of my focus. And that's through, you know, simple exercise and eating our fruits and vegetables.
mhm. Right, right. Some of the things that we all know we should do, but have a hard time putting into action,
Yeah.
depending on what's going on in your life. Awesome. I'm really excited about your practice. I'm excited about the changes that you're bringing to the community there in and around, and the fact that you'll be able to do care right there as well as some telehealth. That's I think going to be really amazing, and taking your background and all of your experiences is really exciting. Can you tell people how they might be able to get in touch with you? How would they find you?
The
Um,
best way is just to look me up at chuprecisionhealth.com.
mhm.
Um, and our social media sites will be coming out soon.
All right. Good, good. I know there's lots of great information on there as well, but a great way to connect with you. Somebody who's so experienced in bariatric surgery, obesity medicine, lifestyle medicine, longevity, all those sorts of things rolled into one.
Yeah.
It's a great thing for all your patients.